The FDA has approved a new blood test for colon cancer. Health officials hope this new test can raise the amount of screenings received for the disease, as colon cancer is the second most common cause of cancer deaths for both men and women. Joining us now to talk more about this blood test is Dr. Jeff Pothof, UW Health Chief Quality Officer. This is interesting. I know a lot of people are hesitant to get colonoscopies because of their invasive nature. Could this be just another way for people to make sure they're getting tested in some shape or form?
I certainly hope so. Colon cancer is definitely a killer. And one of the things that's tricky about it is oftentimes you don't know that you have it. You don't have symptoms until it's too late. So it's really important that people get screened for colon cancer. The gold standard has always been colonoscopy, but there are a couple other options now. There's Cologuard, which is a stool-based test. There's CT scans that can detect cancer. And now this test, which is just a blood test. And I think for some people, having to get off of work or, the fear of getting the sedation or even the prep the night before might push them away from things like colonoscopy, but maybe they would be willing to do something like this test, which is just a blood test, or maybe something like Cologuard, which is a stool test, and get their screening done.
How effective is this compared to colonoscopies?
Yeah, this is about 83% sensitive. Sensitive meaning that if you have colon cancer, this test is positive and lets you know. If you look at colonoscopy, it's a fair bit more sensitive, up in the upper 90 percentile or 90th percentiles. And then if you look at, virtual colonoscopy, mid-90s, Cologuard, kind of low 90s. So a little bit less sensitive, but a pretty convenient option.
Without a doubt. All right, let's keep talking about cancer here and move over to breast cancer. There's a new study talking about double mastectomies and breast cancer. Can you talk more about that?
Yeah, common practice or kind of common approach to women who had breast cancer was to do a mastectomy and then often take both the breast that had the cancer in it, the one side, but then almost as a preventative measure, take the other breast so that you couldn't develop cancer in that breast later. This study looked at over 600,000 women, and it kind of goes against kind of common knowledge, saying that if you look at the mortality rate of women who had single mastectomy versus double mastectomy, it's no different 20 years later. There's caveats to this with regards to what kind of cancer you have and biomarkers you have, but it does, raise an interesting question for patients to talk to their oncologist about whether, it does make sense to take the second breast or maybe not.
And that's a big pool of people. I mean, 600,000, taking a look at all of them,
Yeah. I mean, that kind of those numbers really help you understand to a fine level what the data is saying. So it instills additional confidence in the findings of a study like this.
Without a doubt. All right. Well, let's talk shingles vaccine lastly here. And there's new information that shows that it actually could lower your risk of developing dementia.
This is really interesting because I'm not sure how this would exactly work, but this is an association study. So it's not saying that the shingles vaccine does something that reduces the risk of dementia. But if you look at individuals who get the shingles vaccine versus those who don't get them, and you look at, the rate of developing dementia later, there's about a 17% reduction in those who got the shingles vaccine in their development of dementia versus those who did not. It's not to say that it's necessarily the vaccine. It could be something else that these people are doing, but it certainly is interesting and probably warrants a little bit more additional study to see if it actually is this vaccine that causes this reduction in dementia.
Yeah, if there's some sort of correlation there. All right, Dr. Pothof, we appreciate it. Thanks.
Have a good afternoon.